Hello, my name is Wayne Callan, and on behalf of the ADDitude team, I'm pleased to welcome you to today's ADHD experts presentation. It is titled The Whole Person Treatment Approach to ADHD. Many individuals diagnosed with ADHD find it helpful to combine integrative or holistic strategies alongside conventional psychiatric treatments to cultivate physical and emotional well-being. In this presentation, you will learn about the benefits of integrative treatments, such as lifestyle and nutrition modification, supplements, acupuncture, or a consultation with a holistic clinician. Leading today's presentation is Dr. Lidia Zylowska, an associate professor at the University of Minnesota Department of Psychiatry and Behavioral Sciences, and a faculty member of the University of Minnesota Earl E. Bakken Center for Spirituality and Healing. She is an internationally recognized expert in adult ADHD and mindfulness-based therapies. Her research work pioneered the application of mindfulness in ADHD, developed the Mindful Awareness Practices for ADHD program, and helped co-found the UCLA Mindful Awareness Research Center. Before I hand over the microphone to Dr. Zylowska, I have just a few housekeeping items. Those of you tuned into the live webinar may download the slides now by clicking on the Event Resources section of your webinar screen. And if you're interested in the Certificate of Attendance option, look for instructions in the email we receive about an hour after the live broadcast. If you are listening in replay or podcast mode, visit ADDitude.com and search podcast number 374 to access the slides, the webinar replay, and the Certificate of Attendance option. If you support the work we're doing here at ADDitude to strengthen the ADHD community, we encourage you to visit ADDitudemag.com/subscribe and sign up for ADDitude Magazine for your family or to share with a teacher or a loved one who could benefit from greater ADHD understanding. Finally, the sponsor of this week's webinar is Play Attention. Enhance brain health and performance. For over 25 years, Play Attention has been helping children and adults thrive and succeed at home, school, and work. Their NASA-inspired technology and cognitive exercises improve executive function and self-regulation. Each program includes a lifetime membership and a personal executive function coach to customize your plan along the way. Click here to schedule a free one-on-one consultation to discuss a customized executive functioning training plan for you. You can either call 800-788-6786, or you can visit their website at www.playattention.com. ADDitude thanks our sponsors for supporting our webinars. Sponsorship has no influence on speaker selection or webinar content. You can ask questions of Dr. Zylowska during her presentation, and we will try to get to as many of them as we can after she is done. So without further ado, I'm pleased to welcome Dr. Zylowska. Thanks so much for being here, for joining us today and leading this discussion.
Thank you so much for having me. It's a pleasure to be here, and I want to thank you for making this happen, and for all of you who are joining today, taking the time out of your day to be here. So today I'll be talking about the whole person approach to treating ADHD. So I'll briefly touch on the rationale why we should expand our thinking and approach to ADHD treatment, talk about integrative medicine or integrative psychiatry, and I will touch on some of the tools that come from that field, such as wellness practices or integrative health strategies that some of them you can apply on your own, and some of them require you to work with a clinician. We'll talk about specific applications for ADHD, and then I'm hoping to have some questions and have time to talk with you in dialogue at the end of the presentation. Okay. So first, is ADHD just a problem with attention? And in maybe a wider or broader question, is mental health just something that affects the brain? Something that we think of as, from neck up. And sometimes, we know that, the brain and the body, the mind are interconnected, but our treatments still may have that narrow focus of let's treat the neurotransmitters in the brain, let's work through psychotherapy, work through the mind, and not always incorporate the body or the whole person into our thinking about the disorder and also the treatment. And many of you know, whoops, here we go. Many of you know that ADHD, the name itself is a little misleading. The focus is on attention deficits, on hyperactivity, impulsivity, but it's better conceptualized as a self-regulation disorder. This is a work by Dr. Russ Barkley and others. Seeing ADHD as something that affects not just attention and cognition and energy levels, but also emotional regulation, impulse control. But and with that, how a person with ADHD may react to stress. Research has also shown that there's a higher risk for accidents, relationship difficulties, relationship with yourself, poor self-esteem, and poor self-care that is higher when ADHD is in the picture. Other mental health conditions, such as we call them comorbidities, such as anxiety, depression, substance use, and trauma are more common with ADHD. Same with dyslexia, autism, OCD conditions. But also physical conditions are higher when you have ADHD. In particular, we have pretty good evidence for asthma and some atopic disease, so different type of allergies. Sleep disorders are very common with ADHD, and so are eating disorders, as well as problems with weight. So in a sense, when you think about ADHD, it's not just something that affects your focus, but affects many parts of your life, many parts of your health. And importantly, it affects how you can manage daily stressors, daily habits, and things that also have this influence on well-being. So here, just as ADHD affects many aspects, ADHD treatment can affect many aspects. So if you have a successful ADHD treatment, it will help both the brain, the mind, but can affect your lifestyle choices, healthy practices, can affect how you view yourself, your relationships. So mind, body, spirit, and social, all these dimensions that we think of when we think of whole person can be better. When ADHD management is not done well, when some aspects are maybe ignored or omitted in thinking about in treatment, then you may see that things are not going so well. You may have difficulties with your physical health. There may be difficulties with mental health, an aspect on an outlook on your life. And in this picture on the right-hand side, when your mental health is affected, it's not as if it's just a portion of you that's affected. The whole person is affected. And we know from sciences like psychoneuroimmunology, for example, that immune system, GI system, endocrine system is very much intertwined and constantly talking to the brain, to the mind. And so there's these reciprocal relationships going on. I'm sorry, I'm skipping this slide, but here we go. So when you think about wellness and treatment in ADHD, again, this just shows this relationship that if you treat ADHD symptoms well, things like stress management gets better, your sleep may improve, your mood is often better, self-esteem is higher, and then there's better ability for impulse control, and then daily habits. Healthier habits are easier to keep. the reverse is also true. If you address these secondary things of stress, sleep, mood, self-esteem, or daily habits, it can feed back to ADHD and make ADHD symptoms less severe, less impairing. So that really presents itself in this, feedback loop, and you have opportunities to intervene at different levels. You can intervene at the level of ADHD symptoms or these other secondary symptoms and have these downstream effects. So a good example is anxiety and ADHD. Sometimes we treat anxiety first and ADHD symptoms get better. Sometimes we treat the ADHD symptoms and anxiety gets better. Also true with mood, and similarly with sleep, for example, or stress. And if you take these, different points of entry at treatment into consideration, it also helps to think of, what tools can I bring in to help my lifestyle, my stress, and that's where integrative mental health can be very helpful. We have additional tools that are derived from different traditions, things that are not always brought into conventional care. So you can have this expanded toolbox. And here's some principles that integrative medicine, integrative mental health would apply to treatment. First principle would be that we don't just look at how to mitigate symptoms or absence of disease, but look at what is optimal well-being. And sometimes optimal well-being can coexist with symptoms. So you can still need to manage symptoms, but looking at things like meaning, purpose, how you relate to yourself are also important. Emphasizing self-healing power of the mind-body connection, looking for opportunities to engage that, looking for opportunities to apply self-care skills, so things that you can do on your own to help manage ADHD, looking for natural or safest long-term treatments. And that may mean varying medications depending on what's going on in one's life, or combining it with supplements. Also getting to the root cause, and that's where integrative practitioners can be very helpful, trying to do some additional testing, try to understand dietary influences, and hopefully through those changes mitigate how severe the symptoms are. And integrative medicine also ascribes to this idea that we don't have to use one or the other, the conventional treatments or the holistic or alternative treatments, that you can combine the two, that depending on what the person needs, depending on the situation, some tools can be phased in or phased out. And it's very much done in a collaborative way between the provider and the patient. So here is just an overall outline of the different tools that can be used in whole person or integrative approach to address the mind, body, spirit, social dimensions of a person. We have conventional strategies, we have fundamental wellness strategies, things that some conventional practitioners are already utilizing, something that you can do on your own. And there's some complementary alternative strategies, often referred to as CAM, that are often from other traditions, other cultures, or you need a special practitioner that's trained in an approach to incorporate those approaches. So here's a more detailed slide looking at some of these strategies. On the left-hand side of the slide, you can see conventional strategies that we often talk about when treating ADHD, things like parent training, executive function coaching, psychotherapy, particularly cognitive behavioral therapy, but also therapies that may address comorbid conditions. Trauma may be present in ADHD, so looking at that through psychotherapy. Medications being a mainstay of treatment, but also things like peer support and psychoeducation being very important, something that the ADDitudes magazine provides and some of the other national organizations provide. There's also strategies looking at brain training that includes neurofeedback as well as working memory training. Mindfulness can be put in that category, and as well as approaches looking at kind of electromagnetic stimulation. TMS is an example, such as it's mainstream, not as often used, but it's being investigated. So some of these strategies are more or less accepted in the treatment of ADHD. But if you take a broader approach of ADHD rarely travels alone, there's all these other things that in mental health and physical health that need to be addressed. These other approaches can be brought in. Light therapy is also used, especially if there's a mood component. And then if needed, if the symptoms and the comorbid conditions are really difficult, when there's severe symptoms, considering things like hospitalizations or even ECT. On the right-hand side, I've listed different wellness fundamentals, things, again, that can be done on your own or with support of a coach or a therapist or a clinician, which I think are very important with ADHD. I think stress management is very important, and some of the other things, and I'll go over that in a moment. Looking at relationships, looking at environment, how much time in nature is being spent, and things like security in relationships, but also basics in terms of financial security, pursuing education and career, and having a sense of kind of security in your direction in life. Right at the bottom, we're looking at the CAM, or complementary alternative medicine strategies, also referred to as integrative strategies, that are often done in collaboration with another clinician. And this includes functional medicine, naturopathic medicine, let's say chiropractic medicine, traditional Chinese medicine. So here's some of these strategies that may be utilized, looking at brain-gut interaction, optimizing the microbiome, looking at diet manipulation, supplements, herbs, acupuncture, particularly in the traditional Chinese medicine tradition. Let's say chiropractic medicine may look at manual manipulation, other physical therapies, functional testing, or looking at micronutrients, or looking at different deficiencies or even toxicants in the environment can be brought in. And some of the practitioners are trained in whole systems of care that utilize their own diagnostic tools. So this is sort of a snapshot of the integrative medicine land, as you will, that there are these different tools. It can be quite overwhelming to say, where do I start? And so in thinking about that, there's some things to consider. What are some of the things that you can do on your own, particularly those wellness strategies? Maybe on your own with support of a therapist or a peer group. And what are some that require with another professional? And, is that professional covered by my insurance, or is it something that's out of pocket expense, and weighing those considerations? Keep in mind that ADHD studies using integrative approaches are limited. So still, they're not fully evidence-based. However, based on a specific intervention, the evidence base may be bigger or smaller. There may be more evidence for it for other mental health conditions. So if you do have anxiety or depression, you may bring in an integrative approach into overall treatment because the evidence there is pretty strong. So it's important to weigh those risks and benefits, as well as cost, time cost, financial cost, and thinking through those decisions. In choosing a strategy, there's always a desire to try to minimize medications. And I very much understand that, especially with children. it is important to consider, though, how urgent and impairing the ADHD symptoms are. Are there already consequences in school or at work because of the ADHD symptoms, and we're trying to do something quickly to help the person? If that's the case, I would say medication have an important role to play because they can work fairly quickly. If the person is able to tolerate the medication, it's a good choice to sort of get going, establish some routines, and then with that supportive medication, start bringing some of the other integrative strategies like lifestyle, healthy lifestyle. If the symptoms are not urgent, and particularly if they're mild to moderate, we do know ADHD exists on the spectrum. So depending on how severe the symptoms are, you may choose to start with non-medication approaches, whether it's therapy or coaching, supplements, lifestyle changes, diet. It's important to think about, is this what's doable for me or for my family? And not feel like I have to do everything at once, or feel bad about, not doing integrative strategies, or bad about doing medications. It's what makes sense, what's practical right now. And maybe that will change in the future. Okay. What I often recommend to people who come to me and it's more urgent to start treatment is that we start with medications and then we work on the other strategies, so then you can minimize the medication or stop the medication in the future. Sometimes we start with non-medication approaches first, see how that's working, and we may not need to use medications. And sometimes we phase in because of a certain stage of life, for example, or the person has a big project and uses medication as a tool during that time, but not other times. Okay, so here are the fundamentals that I mentioned. Stress management skills, I really want to emphasize that there's such a reciprocal relationship between the stress, ability to activate executive function skills. Your prefrontal cortex shuts down under stress, and so there's a need to learn how to regulate that, how to regulate emotions, and through that kind of help yourself recover your problem-solving ability, the executive functions. And I'll touch on all these pieces as we go along. So here, this is a common picture of stress response. This is to emphasize we have the two autonomic nervous system paths, one that is activating or response to stress, can bring on the fight, flight, or freeze response. That's the sympathetic nervous system. And we have the other arm of the autonomic nervous system that is calming, soothing, and can bring down the response in the body, in the physiology, after the stress is removed. What's important here is as you see this yellow circle, it says external event seen as a threat. So what is seen as a threat can vary from person to person. What will activate this response can vary from person to person. The same situation may affect different people differently. Oftentimes, the ADHD behaviors, what gets in your own way, or maybe others' responses to the ADHD symptoms can feel very much stressful and as a threat. And so it's very important to understand for yourself, what really activates the stress response for me, and how can I learn to step back and modulate that, and maybe reframe it. Something is a threat, but maybe is no longer a threat if I reframe it. And that very much goes also for negative emotions. Negative emotions can get kicked up when ADHD symptoms are present, and activate self-judgment, shame, fear, and having an ability to deal with those negative emotions in a different way can make a big difference in how much stress is experienced on a daily basis. Here's a quote from William James, a 19th century psychologist, that the greatest weapon against stress is our ability to choose one thought or reaction over another. And that's where mindfulness, something that I've spent a lot of many of my years studying and writing about can be helpful is how you respond to stress and creating a choice in your response. So mindfulness often creates stress for somebody with ADHD, thinking, I can't meditate. This is something that's so difficult for me. So I think it's important to maybe break it down and say mindfulness is trained in meditation, but it's also something that can be activated in daily life through sort of brief shifts in your attention and your attitude. So practicing bringing attention to the present moment, particularly inward, checking in, how am I feeling, what's going on, noticing the body responses, and bringing the attitude of curiosity and openness to that observation so you can learn about yourself and understand yourself a little bit better. And when negative emotions are brought up, oftentimes there's self-judgments, or when ADHD gets in the way, there's self-judgments. So also practicing acceptance and self-compassion. Here's a slide showing that mindfulness is very much a mind and brain training. There are different brain regions that are activated with mindfulness, and they're very much involved in attention regulation, as well as areas in the prefrontal cortex. So there's an executive function training that happens as you practicing mindfulness. I mentioned self-compassion being an important part of mindfulness, and you can think of mindfulness and self-compassion as approaches that, again, can be done through practice of meditation. There's some guidelines or classes that you can take, apps and books, but it's also a question of what helps me connect with myself in the present moment. And that will be, what is my way of being mindful about my reactions? Or what are some ways that help me be more self-compassionate? Okay, you may have your own ways of checking in and bringing that sense of acceptance and compassion. And those are often good places to start if the more typical mindfulness practice seems difficult. And then, there are other ways of exploring, whether it's resources or apps or books or classes on that. Self-compassion I see as a sort of a critical component of ADHD management, because ADHD gets in the way, can be irritating to others, can be irritating to yourself. There can be a lot of misconceptions and judgments that come with that. So being able to have a buffer against it by having proper ADHD education, understanding, yourself better, and then bringing that sense of acceptance, self-compassion, and self-advocacy to your relationships, to your workplace, to your school, to your parenting. And here's some resources that I mentioned on kind of going more deeply into that. So, we often think of management of ADHD as, something you can do in terms of managing stress, trying to mitigate negative symptoms. But there's something to be said about bringing up positivity as well as a way to help somebody thrive. So looking at how can I bring more positive experiences into my life, positive emotions, whether it's practicing gratitude or engaging in things that really bring you joy. So not minimizing the need for that. Finding places where there is a sense of mastery or accomplishment. Even though there's areas of struggle, what are some of those areas when someone can experience accomplishment and feeling good about yourself, what you're able to do? Looking for areas where you can bring sense of meaning or purpose. I know that oftentimes, getting engaged in advocacy can be very meaningful and also create connections. Authentic connections to self and others are very important, and that's where bringing yourself, or family members to these meetings, the webinars, to conferences is very important, and also taking the time to sort of figure out, what within this ADHD world that I'm learning about applies to me. Some of it will not apply, some of it will. So being self-affirming and knowing that, this strategy helps me, this does not help me. And having that internal compass as you navigate through so many different options. So through psychology, we can help manage stress sort of top down, but there are also things that are really important to engage as a sort of a bottom up approach to mind, mental health, emotional well-being. So physical exercise, very helpful with ADHD. So making time to have some of that. If exercise feels like a big undertaking, just thinking of movement or time outside in nature, moving in nature is something that can be very helpful. Approaches like yoga, Tai Chi, meditation can be also helpful, particularly because they emphasize breath work. And breath work, there are different approaches to breath work, but having a way to set some time or have some practices that help you deepen your breathing, slow down your breathing a little bit, are ways to put brakes on chronic stress. So stress will make you breathe more shallow, usually faster. And so giving your body opportunities to have deeper breaths, slower breath can counteract the impact of chronic stress. So, self-care habits. Habits are hard with ADHD. Persistence is difficult. You can have good intentions, hard to keep up with things. But there's some key habits that are worth really investing and putting energy in. Things like sleep and a sort of daily structure, making sure that there's a regular time to bed, or at least some effort to not stray so much from day to day. Looking at, regular meals, hydration, those things can really support brain function as well. It can support cognitive abilities or in the moment. Looking at your environment, how the environment can support you. Starting with things like, organizing your workspace, to things like, are there things in the environment that are actually affecting my physical health and maybe also affecting my cognitive health, like toxins. For example, pollutants in our food can have an effect on the brain and cognitive function. Looking at opportunities to decrease that burden, such as looking for organic foods or looking at cleaners that may be more friendly, not as toxic to the environment, or even looking at things, as testing, functional testing with a naturopath physician that might be helpful. So discerning for yourself, is this an important area for me or not to address? Because not everything can be tackled at the same time. Looking at rhythm of work and breaks, very important as a sort of replenishing that self-regulation ability or self-regulation tank. This is a term used by Dr. Barkley, which I really like, that you think about, starting a day with a certain capacity to tackle things, tackle tasks, tackle relationships, interactions, and then that can be either supported by certain habits or it can be depleted more quickly by certain habits. Not having enough breaks will be one of them. Certain food choices or diet can impact that. Having not having ability to have exercise breaks or kind of a replenishing activities will also affect it. And thinking of those habits as a way to support yourself, putting importance on yourself, like I matter, these habits are really important. And there's maybe a lot of pressure from the outside to not, not attend to myself, but self-care as an act of resistance. I think that sometimes that can resonate with those who who have a rebellious streak is to say, these things are important. The stuff from outside can wait, or I can make time for myself. Healthy diet, so important. You can start by stopping the bad foods and look at what are the good foods. Typically, we talk about food dyes and preservatives as aggravating ADHD for some individuals with ADHD. Particularly, there's studies with children. Not every child is affected, but some are, and it's worthwhile to remove those. And as you remove dyes and preservatives, you also tend to start using less processed foods, and that's actually increasing the good foods in your diet. Some people are more sensitive, especially if there's a history of allergies or asthma, or there's a tendency to get rash after eating certain foods. It might be worthwhile to look at inflammatory foods and taking them out of your diet. The two most important ones are gluten or wheat, and also casein, which is the protein found in dairy. Starting there is helpful. Some people do testing, functional test, sort of a food sensitivity testing. That's controversial. It's looking at IgG response to different foods. There's still some, lack of understanding whether that represents just exposure to foods versus sensitivity to them. Those tests can be helpful. Sometimes they're overwhelming because you may find you're sensitive to everything. So having another way to prioritize what you're eliminating using Elimination Diet and working with a nutritionist can be very helpful. An Elimination Diet is by taking things out, keeping diary, and reintroducing foods gradually, and then seeing your response. That's the gold standard to find sensitivity. Other things to remove would be red meat, processed meat, refined grains, and sweets, as well as high-fat dairy. The good foods are very much aligned with what's called Mediterranean diet. As you can see, whole foods, minimally processed. Looking also at glycemic index of food, or how quickly the food increases your sugar in your blood, because you may have the spike and then crash. So looking at that. Looking at how many nuts and berries you have in your diet. Those are very healthy foods for the brain. And then things that can support the gut by using prebiotics, vegetables, fruits, as well as fermented foods, the probiotic foods, foods like yogurt, for example, and kimchi, sauerkraut, things like that. Quickly, here's a picture of a modified Mediterranean diet that was studied in depression, looking at the fact that if you change your diet, your depression symptoms can improve. And so this gives you an idea of sort of what are different recommendations that you would want to, what would you want to have in your diet as a basis. We're not talking about perfection here. You can sometimes have foods that are processed or sugary, that's okay. But what is the base, the baseline for you when it comes to diet? Are these, components part of your regular diet? We know that healthy diet can affect the microbiome in the gut, and that itself has these upstream effects in terms of reducing anxiety symptoms. Serum cortisol level is often lower if there's a healthy biome. Inflammatory responses are decreased. And there are some interesting studies looking at, responses on the functional responses in the brain to manipulation of diet. So using yogurt as a manipulation in as an intervention, and looking how anxiety as well as the brain responses to stressful stimuli change because of that intervention. So through food affecting the brain. Now, talking about supplements, there are supplements that are studied for ADHD symptoms specifically, and also there are supplements that are studied more for general mental health support. And both of those can be combined in treatment of ADHD. As I talked about before, questions to ask if you're thinking, should I be using supplements, is how severe your symptoms are, what are other symptoms, what is the diet, are there suspected GI issues that may affect malabsorption, and then thinking about the costs and the amount of pills that may be required if you're doing supplements. The first place to start is always diet. And if that is not enough, then thinking of supplements. Here are common supplements for ADHD. Omega fatty acids have pretty good evidence base. You want to have more EPA versus a DHA amount. It's important to look at the EPA and DHA, not just the amount of fish oil, but what are the actual amounts of these two components. And using about 1,000 up to 2,000 milligrams to supplement. Zinc, as well as ferritin, which is a marker of iron stores in the body, are very important for ADHD. They tend to be lower when you have ADHD. We still don't know, what causes what, but oftentimes supplementing zinc or supplementing iron. You can start with iron-rich diet or actual supplement if deficiency is severe, can help reduce the need for stimulants or have a better response with stimulants. So actually supplements and medications can work together. Or you may avoid using medications. Other things that have good evidence is using vitamin D, which also tends to be lower with ADHD, and optimizing sleep with melatonin. Other supplements listed that are very common are using magnesium, can help with anxiety and sleep, also gets depleted with stress, so using that can be helpful. It's something it's hard to measure the level of in the body, so sometimes we just use it empirically or based on symptoms. B vitamins being critical for production of neurotransmitters, being cofactors in many brain processes. It's often helpful to use a B complex formula as many B vitamins work together. And there's also pretty good research in adults and in children using what's called broad spectrum micronutrient formula. Again, getting away from maybe using one supplement to using multiple supplements as a way to help ADHD symptoms. Herbs are also used. They're important component of integrative treatment, especially if diet or those more evidence-based supplements are not helping. I've listed some of them that have evidence in ADHD, and then depending on these other symptoms that may be present, whether it's more of a problem with sleep or anxiety or needing more energy and motivation, you can either use more activating or more calming herbs. It's important to look at quality here, not so important with vitamins or minerals because they're pretty standard, but when it comes to herbs, how they're harvested, how they're prepared is critical, and it can really make a difference between response or not response. The two herbs I really like to use, again emphasizing how important it is to manage stress in ADHD, is herbs called adaptogens. There are many different adaptogens. I highlighted two, rhodiola rosea and ashwagandha, because they're kind of opposite. Rhodiola tends to be activating or stimulating. Ashwagandha is more calming. So if there is more of an anxiety picture, sleep difficulty, you can use the calming adaptogen, ashwagandha, and those can be combined with vitamins and micronutrients. Or if you need more, if you're wanting to avoid stimulants, you want something more stimulating, rhodiola rosea would be a good choice. When working with integrative provider, I think it's important to think about, where do I want to start? What makes sense to me? Or maybe even just talk and interview different providers. What is your approach like? Because there's so many different trainings. People come from different, you could say, angles at healing or at diagnosis and treatment. Here's some examples of integrative providers: naturopathic medicine providers, functional medicine providers. They're quite similar. They will emphasize some testing, laboratory testing. There's chiropractic medicine that will also look at manual manipulation, and then whole systems of care that have their own diagnostics, like Chinese medicine and Ayurveda. I wanted to just quickly say that acupuncture is not something we typically talk about in treatment of ADHD, but I find it quite helpful, in part because it is part of kind of more overall whole person approach with herbs and dietary lifestyle advice that's part of Chinese medicine approach. It's also often covered by insurance, particularly if there's additional pain or stress-related conditions. So it's an option for those who might be out-of-pocket cost for other integrative providers significant. And it's also a good option for those who have trouble finding, engaging in strategies to bring that time of parasympathetic response or relaxation, or offsetting the stress. If you're having difficulty meditating or finding relaxing strategies, and you're not afraid of needles, then acupuncture could be a good place to try. I mentioned some of these. It's important to find someone who can work with you in a collaborative way with you and your other clinicians. You can interview different providers, and there's places on the internet where you can find people who are trained and certified in different approaches. And I've listed Academy of Integrative Health and Medicine. There's also American Association of Naturopathic Physicians, Institute of Functional Medicine. There's Institute of Functional Nutrition. So finding providers there can be helpful. Just a quick snapshot. We're running out of time, so I'm just going to quickly say here on the left side some things that maybe a conventional provider would use, and on the right-hand side, things that can be added, things we've mentioned, to the whole person approach in ADHD. Okay, so in a way, just closing thoughts, medications can be phased in, phased out, or stopped as needed, depending how much you invest in these other strategies. And I think it's very important to prioritize and have support when implementing integrative approach. So not being alone in this journey, but having a therapist, community support, working with a coach, family members that are aligned with your desire to bring integrative approaches can really make a difference. And after the webinar, you can check out some of these resources, books on mindfulness, self-compassion, integrative approaches specifically for ADHD, and then integrative approaches to the other comorbidities that can be common with ADHD, or expanding your thinking about this area. So with that, I'll stop, and hopefully we'll have some questions.
Yes, there were plenty. That was excellent. That was really excellent, very insightful. A couple of people have asked, there are many mindfulness apps out there, Calm, Headspace, Insight. Are there any that have been found to be better for people with ADHD?
People vary what they resonate with. So I think I always recommend trying to listen to a couple different options and finding the one that's helpful. I do like Headspace because they do start with very brief meditations. They have also some visually appealing little videos, which I think is ADHD friendly. Another app that's been designed more for teens and young adults is called My Life. Used to be called Stop, Breathe, and Think. And so there's, there's emphasis on variety of practices, sort of learning to do things in a playful way. I think that's ADD friendly, ADHD friendly. There are, there's also a new app. As a full disclosure, I am connected to them as an advisor, but there's an Inflow app which brings ADHD education and CBT strategies, and also has some short, brief kind of core mindfulness practices as part of it as well.
Mm-hmm.
But really kind of, I want to empower people to say there is no one place, try different apps and find the one that works for you.
Mm-hmm. What about cannabis and CBD oil? Several people are using it and said that they found it effective for themselves. Does that fit into your treatment plan, or there's not enough research on that front?
Not enough research
Mm-hmm.
is the state of the evidence right now. And there's a lot of controversy about using cannabis products in general in mental health. In general, if you're using a cannabis product, it's better to use CBD versus anything that has THC in it, just because the THC component of marijuana or cannabis is psychoactive, meaning can affect your cognition, and it can also affect your mood. Some people find that helpful for anxiety, but it can also have kind of backfire by sensitizing to anxiety. So,
Mm-hmm.
if somebody thinks this has been very helpful for them, I generally try to discourage THC and steer them to try CBD instead. It's not something I utilize in my treatment very much. So if I do see it has a role for pain and for being anti-inflammatory, and if that's part of the whole person's sort of health picture, then I would refer to, let's say, naturopathic colleague that utilizes CBD, so they can, advise the person on that. CBD products are quite expensive, and there may be other anti-inflammatory options, so that's also important to consider.
Mm-hmm.
But again, it's a collaborative approach in general, so working together with the patient as well, maybe as another practitioner, to figure out what makes sense for that particular person with their set of symptoms.
Mm-hmm. Several people have asked they weren't familiar with TMS. Could you explain that?
TMS. So it's transmagnetic stimulation.
Yes.
So TMS is used quite a bit now for treatment of depression. And even for anxiety, but the FDA indication is primarily for depression. It's something that some insurances cover, but usually after you've tried other things. It has been studied in ADHD, but it's not seen as a kind of approved for standard treatment of ADHD. So there's some encouraging studies, actually, I think they're from Israel, showing that TMS treatment was helpful. This is when adults with ADHD, and then, based on sort of the EEG pattern of the person's brain before treatment, you could say who's more likely to respond. But it's early research, so we're still kind of in this early phase of trying to understand, is it helpful for ADHD across different spectrum of symptoms, and then having more evidence so it could become more standard.
Mm-hmm. Does it make sense when you're looking for and interviewing a holistic practitioner to put him or her in touch with your primary care physician to see if there would be a collaboration, or do they not have time for that?
I think that's very important to see if they can collaborate. That it's not always the case. People do get busy; they don't always get in touch. But I think it's important to at least communicate with all your providers what you're doing. So letting them know, I've engaged, working with a functional medicine doctor as you talk to your primary care doctor, and get a sense of, are they open to it? Would they want to know a little bit more about what's happening? They may dissuade you, and
Mm-hmm.
you have to then use your own judgment. Do I take that advice or not? There is some strong biases in the conventional community about some of these approaches, or opinions, I would say.
Mm-hmm.
But, I would say that has changed over the last 10 years. A lot of, conventional clinicians, a lot of psychiatrists nowadays are open and very interested in integrative approaches. They want to utilize different tools They might not know enough how to utilize them, but they might want to talk to your integrative provider and have a relationship and check in. And it's also important that whoever you're working, there is someone that you're working with that understands the interactions between medications and herbs and supplements, whether it's the integrative provider or maybe your physician is willing to advise you on that, because there are some contraindications depending on the supplement or herbs that you have to be aware of. And that's very much true if you are on an anticoagulant medication, for example. There may be some interactions that affect levels of medication. So it's something that you would want to ask one of your clinicians if they can talk to you, help you figure this out. Is it okay to take the supplement with whatever else I'm taking?
Mm-hmm. Several people are interested in neurofeedback, and they want to know if there's any good evidence for its benefits.
Yes, there is good evidence for effectiveness of neurofeedback. There are different approaches within neurofeedback, different ways people train neurofeedback. There are certain trainings that have been studied more than others. There's a theta-beta ratio training. There are other sort of markers that people look at and trying to regulate the brain, and that's related to better response. I am not someone who provides neurofeedback, so I'm not an expert in this area. Mm-hmm. But I would say it is something that has evidence-based. What you want to do is find a practitioner that is trained well and can kind of tell you what training they have. And then you can always try and just see if it's a good fit. I definitely think, it can be helpful. It is time-consuming treatment. Often you need 30 to 40 treatments. It's not typically covered by insurance, so it can be costly. So it's something to consider, but it does have lasting impact. So you can, typically people who have gone through training and have benefited from the training, they retain that skill. It doesn't go away when you stop the training.
Right. Several people have asked about diagnosis. One woman had said, would I see a psychiatrist or a neurologist for a diagnosis of adult ADD?
So psychiatrists, some neurologists would treat ADHD as well as primary care doctors. Some family physicians are quite comfortable treating ADHD. But if you want a more thorough diagnosis that's also taking into account other mental health disorders, a psychiatrist are best trained, or maybe starting with a psychologist. Some psychologists can do diagnostic assessment, and also neuropsychologists can do a diagnostic assessment. And so you could start with a mental health provider, and then they can guide you to what's the best way to get assessed, and then what's the best way to then get treatment. So you may start with a psychologist for ADHD assessment, and then once the diagnosis is established, then you may need a psychiatrist. You can start with a psychiatrist who may refer you to a psychologist for testing, and then come back for medication treatment, for example, or for other treatments. So I would say, that's a good way to start. For children, it's a little different. The question is about adult ADHD, but for children, pediatricians and especially neurobehavior trained pediatricians are a good choice. Neurologists can also help more likely with children than with adults.
Mm-hmm. Finally, someone says, how do we keep up? How would she be able to keep up with all the trends on the alternative medicine and ADHD front? Are there any publications you recommend? Several, maybe, that you recommend that they could read just to stay on top of the studies?
Yeah, so I think actually in the last, in the recent past, last maybe 5 to 7 years, there have been books that have come out on integrative treatment of ADHD. I've had it on my slides there. There's a book by Patricia Gerberg and Richard Brown on integrative approaches to ADHD. Dr. Newmark, Sanford Newmark, has had a book that's been updated. That's a good resource. And Dr. Jim Greenblatt has another one. There's somewhat different, ways to approach ADHD, but you'll get a lot of information from those books. I also like the book called Natural Mental Health, which has a lot of very sound advice, especially for children and families with ADHD. It's written by a pediatrician and family medicine doc, I believe.
Mm-hmm.
So there are these sources. I think ADDitude magazine actually has quite a few resources, and there are periodic webinars on what's the latest in this sphere. There are other ways to do it. But I would say, working with someone is helpful. Finding a clinician so that keeps on top of this and then can help you make sense of all the different things and
Right.
help you prioritize things. I think I want to stress that things can be so overwhelming when you look at, should I be doing this, and then you end up with multiple bottles of supplements and still feel pressure. I should be meditating and I should be working on my diet. That can be too much. So I would say looking at the list of different approaches, maybe that slide I had there for different wellness approaches or integrative approaches, pick one or two and say, this is, I think, where I can put my energy, because I think this will make a difference. And I would say that the top 4 things would be diet, exercise, sleep, and then some way to regulate your stress. Mm-hmm. Some strategies and understanding what stresses you, what helps you.
Right. Well, I think the hour is up. Thank you for joining us today and for contributing your voice to the ADHD community. It was great to have you.
Thank you so much. Thank you for having me. I appreciate being here.
And make sure you don't miss future ADDitude webinars, articles, or research updates by signing up to receive our free email newsletters at additudemag.com/newsletters. Next week, our free webinar will be part of our ADHD Awareness Month series, combating stereotypes about women, men, and children with ADHD. And the experts will be Ned Hallowell and Sari Solden. So we hope you can join us. Have a great day.